health update, and also a meditation on the extremity, but also medical aloneness of ME. So I'll tell you what's going on, and I'll tell you what it means in the context of people with conditions like me. So 10 days ago, I was hospitalized with extreme hard breathing symptoms to do with microvascular angina, microvascular damage post-COVID 8 months ago, and I've had myalgic encephalomyelitis for 20 plus years. Since then, I've had episodes which contain 3 elements getting worse. Element 1 is microvascular damage, so pericardial, myocardial damage. Element 2 is an extraordinary sort of radioactive rush of toxic feeling through the body that also comes with nausea and temperature control disturbances, and that's stuff that makes me scream. I'm not sure if I'll add a little example here or not. And the third element is either through brainstem inflammation or brainstem compression, I'm losing control over breathing and swallowing functions. And for the first time today, having episodes of paralysis where the brain can't send signals for the throat to not just swallow, but for the arm to move. There are 15 experts in the world. I'm making that number pulling it out of thin air, but it's roughly that, who have a long history of thinking about this stuff, researchers and clinicians. Hope to speak to one of them very, very soon, in whose sort of long-term care I've been for a long time, Nancy Climbers. But that's how long you are. And I am a patient who has access, although not ongoingly, but has access to a world expert on post-COVID microvascular damage, have access to at least one of the handful of the world's major ME experts, have access to probably the best person, one of the best people you can speak to in the UK as well on ME and long COVID. So this is a situation of helplessness for me in the context of extreme privilege of access. So imagine what other patients in my situation are going through. So right now my options are to hear more medical advice, meanwhile trying to weigh up, as I have been the last 8-9 days, between ambulance, private hospital, trying to stay at home. One of the problems I've suffered just in the last day or so is that I'm reacting with extreme angina and paralysis to any food, which is a trajectory you don't want to be on. So that's the situation. And I don't know what that means for the chat channel, for the main channel, in terms of when I'm going to be around, but I'm very good at being around for 5 minutes, even though I'm very ill, so we'll see what happens. That's the update. But it's personal, but it also just gives that context about, holy crap, right? There's people in big numbers experiencing significant chronic illness, and we haven't done enough to even have enough clinicians and researchers in a position to get what WTF is happening with them. Lots of love, and of course, strength and courage to everybody who is going through challenges.